Shujat Ali from Medico's Lectures by Shujat, and today we are going to discuss with you anatomy of lungs. But at first I want to thank the management of my university, the way they are providing me their support. Without their support, these videos were not possible at all. Now discussing my original topic, anatomy of lungs. Lungs, they are spongy air-filled organs situated on either side of mediastinum. In this case, this is mediastinum situated on either side of mediastinum. Talking about the parts of lung. So it has apex, a base, and 3 borders and 2 surfaces. For getting these parts, first discuss the basic points. So lungs, they are rosy pink color in newborn, and in adults due to the accumulation of carbon and impurities, it turning into the blackish pink. And weight is of right lung, this is right, it is 700 gram, and for left lung it is 600 gram in adults. Talking about the parts one by one, and after that site determination. So this is the apex. On the apex, here is a groove for subclavian artery is present. We have 3 borders. This is the sharpest, this is anterior border, and this thickest is posterior border, and this border is inferior border. We have 2 surfaces. This outer is costal surface because of its relation with costi, and this inner is mediastinal surface. Now, this border, this is the sharpest border. We know it as anterior border. It is thin for right lung, and when we discuss it for left lung, so for left lung, there is a tongue-like depression which we know as linguilla, which is present here. Talking about the posterior border. Posterior border is thick and rounded for both. Talking about this inferior border. So this inferior border, as its shape shows, it is semilunar in shape. Now, this is the base of the lung, and base is diaphragmatic and concave in shape. And concavity is basically due to the diaphragm because it is present above that of diaphragm. So base is diaphragmatic and concave. And talking about the costal surface, that is going its relation with costi. So this midclavicular is for rib 1 to 6. It is going to be attached or related with that. And that axillary region is for rib 1 to 8. Now, this is the mediastinal surface of right lung. So here we have a groove for right atrium. This is that groove. And right atrium, it opens into superior vena cava and inferior vena cava. And the whole is arch that is present around that higher portion. There is an arch around that higher portion. In the same way, if we talk about the left lung, this is the left lung. So we have here a groove for left ventricle. We have ascending, descending branch and arches of aorta. These ascending, descending and arches of aorta, they are open into the left common carotid artery and celiac artery. Now, discussing the fissures and lobes of lungs. So for right lung, first we have 3 lobes and 2 fissures. 3 lobes are including superior lobe, middle lobe and inferior lobe, separated by 2 fissures, which is oblique fissure and horizontal fissure. And for left lung we have, if I take this lung, so for this we have only 2 lobes, superior and inferior lobe, separated by only 1 fissure, which is oblique fissure. Now, talking about the root of the lung. A root is basically the point or the area from where points are either enters the lung or leaves the lung. So for right lung, I have right lung right now, we have a mnemonic BAVB. Why BAVB? Because at first point we have principal bronchus, which is 2 in number. Then we have pulmonary artery, which is 1 in number. And after that, from V we have pulmonary veins. There are 2 in number in right lung. And after pulmonary vein we have a bronchial, which is 1 in number. In the same way, I have left lung right now. So for left lung we also have a mnemonic. In the same way, for principal bronchus it is 1 in left lung, and pulmonary artery is 2 in number in left lung, pulmonary vein is 1 in number in left lung, and bronchial bronchus is 2 in number in left lung. Now talking about the clinical correlates. 2 types of clinical correlates we have in lungs: obstructive pulmonary disease and restrictive pulmonary disease, or obstructive lung disease and restrictive lung disease. In obstructive, a patient cannot get air out, such as in emphysema and in allergic asthma. And in restrictive lung disease, a patient cannot get air inside, such as in sclerosis. And this is our basic lecture on anatomy of lungs. Hope you all understand it well. Don't forget to subscribe to Medico's lectures by Shida. Thank you so much.